Hey everyone, welcome to another episode of Medcouragement. We're so excited to have you with us, and we have another great interview today. Today we're going to talk about a very prominent and important topic, and that is breast cancer. And as many of you know, breast cancer is one of the most common, prevalent cancers in the world. We have over 1 million women who are diagnosed every year worldwide, and over 250,000 of those will be diagnosed in the United States. We know that breast cancer kills up to 40,000 women each year, and it is so important to make sure that we have the message out about its awareness, about how women know when they are supposed to be getting surveillance for breast cancer, seeing their physicians on a regular basis, as well as doing self-checks, because as we know, mammograms are not perfect, and that it is always important for women to continue to do self-exams as well. So we're going to talk all about that today. We're glad you're with us, and we're going to introduce our guest today. So Lori Patterson, thank you so much for coming to be a part of Medcouragement for us. And we'd just love to hear a little bit about you so our viewers can know a little bit about who you are.
Sure.
And your family and what you do.
So I'm 44, I'm a teacher, and I have 2 children, a 15-year-old and a 12-year-old, and I'm married.
All right, well great. So tell us a little bit about how you even had any idea that there was anything going on with you. You're obviously, once we sort of turn 40, we always begin, I think all men and women both begin to get a little bit more vigilant about their health, a little more concerned. Things we may not have worried about before, little chest pain here and things like that. We may begin to think, oh my gosh, maybe that is something. Maybe I am getting to an age where I need to be concerned about this. So what was it with you that sort of got you to the point where you ended up getting diagnosed with breast cancer?
For me, it was an incidental finding. I just happened to run across a lump. And when I sort of looked into it further, it didn't feel normal. You might feel the lump, and this one felt different, I would say. So I immediately called my GP, and she said, come in and let's check it out.
All right. So you had been seeing the doctor regularly.
Yeah.
And when did you have your first mammogram?
I was probably 38 when I had my first, and I went religiously once a year, and they were all normal. Okay.
And did you have a family history of breast cancer or anything before then?
No, nothing.
Absolutely nothing. So you had no risk factors as far as you knew. Okay. And so how long had it been since you had had your last mammogram before you found the lump?
It had been about 11 months.
Okay, so within a year, and of course, we absolutely, general practitioners, family practitioners, OBGYN doctors, always counsel women that they should do monthly breast exams to do those things. And so it was something, obviously, you were paying attention to your body, which is always an important thing to do, especially as we get older. And there it was.
Yes.
Yeah. So it's nice to kind of have some reassurance that you had a clean report, but at the same time, you still have to do your due diligence and follow up with good health maintenance. Okay, so scary moment.
Yes, very scary. I think the word has such a negative connotation. When you hear that word, you immediately think the worst.
Right.
So yeah, just the word, it's scary. I think for me, and thinking about telling my kids and my family, and having to say cancer. Right. That's a scary word.
Did you tell anyone that you had found the lump and that you were going in to get it checked out?
I immediately told my husband.
Okay.
First person I called.
Okay.
Yeah.
Right.
And I think probably my mom.
Okay.
Yeah.
So 2 people in your corner.
Oh, yeah.
Okay. And so you go in to see your practitioner, and then what happened?
From there, she said there's definitely something there that needs to be checked. So from there, I went for a mammogram, just a normal mammogram, and that's when they said it needed to be biopsied.
Okay. And let's pause here for just a second, because I think an important question for a lot of women is, well, what am I feeling for? And you know, we know that the most sort of common classical presentation for a breast mass is it's going to be very hard. You're not going to be able to sort of move it around. Typically, it's just a single lesion type of thing. And then in some cases, some women may even notice that their skin colors change a little bit. There might be some dimpling and so forth. So was that classical presentation similar for you?
For me, it was a lump, and it did not feel normal. As soon as I felt it, I knew, just in my heart, I knew something wasn't right. But looking back on it, I also now kind of remember, oh, there was some itching that maybe I thought was just dry skin at the time, and that's another, you know.
But it distinctly felt different than all your other surrounding breast tissue.
Yes.
Right, because we know some women have breasts that are more dense than others, and so it's important to sort of know the characteristics from those self-exams, and so consequently, you knew this is definitely.
It was definitely different.
Yeah.
There was a hardened area. It was defined.
Yeah. Okay. And so we head for another mammogram, ultrasound. What did they do next?
I went for an ultrasound and a biopsy all on the same day, and when they biopsied it, of course, found out that it was cancer.
Right.
I think when they initially looked at it, they said, well, it may not be cancer, it may be cystic, and that's it. But then in fact it was.
So let's walk our viewers through, you know, ultrasound. Everybody's pretty familiar with that. I mean, a lot of people have had prenatal ultrasounds, and they put the jelly in there and just sort of run the probe. But as far as a biopsy goes, biopsy is always a scary word.
Right.
What is the process by which they obtain some of the breast tissue?
That one was a needle biopsy, I believe. And it was fairly painless. I'd say the after effects were bruising and slight pain.
But they numb you up a little bit, and
yes,
a little bit of numbing, and then needle goes in and take a sample of the area that they're concerned
and
about.
I think it was even like a vacuum biopsy.
Okay. And so how long did you have to wait before you knew the results of that?
I think that's the hardest part
Yeah.
For the whole thing, is waiting to know what is going on. So probably about a week.
Okay.
Yeah.
So you probably didn't sleep very well for a week.
No, I had a feeling
Right.
what they were going to tell me, so it was a long week.
Okay. So mom knows, husband knows. Anybody else during this week, or are you still?
I think I told my mother-in-law
Okay.
as well, and I waited to tell the kids.
Okay, because you weren't sure.
Right.
You didn't know.
Yeah,
Okay.
and I wanted to, I don't know, I just needed to wait.
Right, and that's, you know, and I think that's important, is that everybody's journey with this diagnosis is going to be different.
Oh, I think so too.
And what you're comfortable doing, some other person may not be comfortable with.
Right.
And I think that's okay.
Right.
So, phone call, come on in, phone call.
It was a phone call. Yeah, my son and I were getting ready to go to the pool, and I got a phone call, and it was just a sort of matter of fact. I'm so sorry to tell you, but we did find some cancerous cells.
Okay.
And again, I wasn't surprised. I just kind of knew. So from there, it was we're going to do some more pathology on this and get down to the bottom of exactly what we're dealing with, and we'll have you come in.
Okay. And so, how long after that conversation before you're back in an office?
Probably another week.
Okay. So another week goes by. And now, again, mind's racing.
Yeah, the most nerve-wracking part is, I think, for me, it was the waiting on pathology and finding out what type of cancer is this, because it affects your treatment.
Right.
So, yeah, anytime that you have to wait on the pathology, that's the most nerve-wracking part.
And they're probably looking at the types of receptors that are on the cells.
Correct.
And the different, whether the margins are what's called margins are clean,
Right.
whether or not it looked like it spread outside of what they had done.
Correct.
Okay. So during that week, our kids notified.
Yes.
Okay.
Yeah, I finally told my kids, and I had talked to the surgeon about, is there a good way to do it? And there's really not. It's whatever works for your family. And for me, I didn't want, my kids knew something was wrong, but they didn't know what, and I thought it was scarier for them to wonder than just to know. So when I told them, no one in our family has really had cancer before, so that was almost a good thing.
Right.
I was able to tell them and then sort of say, but the doctors say everything's going to be fine, we'll have surgery, and I'll take medicine and do other treatments, and it'll be the end. Right. So I tried to keep it as light as possible.
Sure. How did they respond? Two young men got their mom?
The 12-year-old, I think, really didn't get it. The 15-year-old's first words were, but you'll be okay. And I said, yes. Yeah. Be fine.
Yeah.
So, yeah.
So emotionally, how did you hang in there with
it's
all this?
It's hard.
Yeah.
Yeah, it's really hard, but I have such a good support system. My husband has been amazing. My kids, my family, my mom, my dad, my brother, literally everybody has been wonderful. And then my work family, they're like regular family to me.
Sure.
My best friend. So I have a huge support system, and that really does make it easy. And for me, it felt good to talk about it.
Sure, absolutely.
Yeah.
And it's certainly one of those diseases that there are always going to be people who say, yep, I've been there.
Yeah.
Or I know somebody who's been there.
Yeah, I loved finding somebody who was a breast cancer survivor and was able to, it just felt good to know that there was somebody else out there.
Right.
Yeah.
Okay. So we get details back, and then next plan is surgery?
Yes. Okay. Next plan is surgery. Actually, I had an MRI first, just to see if it had in fact gone anywhere else and what else you're dealing with.
All right.
And then it was surgery. They tell you what kind of cancer you have.
Right.
And mine happened to be progesterone and estrogen positive and HER2 negative. Okay. So that kind of helps you with your treatment. And they tell you what your options are. Right. Mastectomy or a lumpectomy. And just with tumor size, I ended up doing a lumpectomy. Okay.
So day of surgery, nervous, but maybe a little excited to remove something that is potentially,
Yeah, the whole team of doctors I have, they're awesome. So, they come in, they're excited to get you back onto the road to recovery. So
right. And where'd you have your surgery done?
At Cabell Huntington.
At Cabell. And who was your surgeon?
Dr. Legenza.
Wonderful. Okay. So did you stay in the hospital after your surgery?
It was outpatient, so I did go home.
So in and out. Isn't that amazing?
Yes.
You can have a surgery for breast cancer and be in and out same
it's
day.
Amazing.
Okay.
Yeah.
And so obviously you had a little bit of recovery from that. And then what other treatment did they have for you after that?
After maybe about 6 weeks after you've healed from your surgery, for me, I had radiation. And I had 21 total treatments, but it was broken down into 16 regular, I think it was whole breast treatments, and then 5 what they call boosts, which go directly to the tumor area.
All right. And did you tolerate all that pretty well?
I did. I suffered some of the normal side effects with the radiation burns and some itching and swelling, but it seemed I've recovered.
Right.
Yeah.
Okay. Wonderful. So I think some of the things that just to back up a little bit is just to talk a little bit about how some women present with breast cancer, and we know that probably the majority of them end up being seen because they did have an abnormal mammogram, but up to 15% of them show up and they had a lesion that did not show up on the mammogram. So they're not perfect. And then about 30% of women will actually develop something in between their mammograms, which kind of goes to our screening recommendations. And, when you sort of look at screening recommendations for mammograms, your 38, 40, is some groups will say, yes, 40 is a good age to start. Let's check them every 2 years. Some groups may even push it back to 50, and then they sort of look at different risk factors and so forth, whether you had a family history of breast cancer, as well as things like ovarian cancer, either personal or a family history of those things. And we know with some of the genetic testing that's out there, there's some women that are going ahead and looking to see if they have the gene mutations that will predispose them to get it.
Yeah.
And even doing some elective mastectomies.
And that changes your treatment options too, if you know, because I had genetic testing and everything came back negative, but had that been different, I probably wouldn't have chosen a lumpectomy. I would have chosen something else.
Something else more aggressive. Yeah. So it's obviously a journey. So from sort of start to finish, so to speak, what time period are we talking about when you took your last, from the time you sort of felt the lump until your last sort of treatment?
I would say I felt the lump the end of May, and then my last radiation was October the 3rd.
Okay.
And then I don't feel like I'm really, I mean, I guess I'm technically finished with treatment, yet I do have medicine that I take that is going to help keep it from recurring. So
Right. And so how often now do you sneak back in and check in with your doc?
Every 3 months right now.
Okay.
And then it goes to every 6 months.
Okay.
And then to every year.
Now, are you continuing to do mammograms at those times, or are they doing physical exam only?
It's physical exam right now, and then when I go in April, I'll go back for my first mammogram.
Okay, so we sort of start over again. And keep a close eye on everything, and make sure that nothing else sneaks in, type of thing. Very good. So, life lessons. All of us kind of motor along in life, and we're very blessed to be healthy. And you were a healthy person up to this point. This is the first major anything you'd ever had.
Right.
So what types of things did this sort of life lesson teach you?
I mean, it's definitely, I would say the most important thing is you really do learn who your friends are and how great your family is, and how much love you're surrounded by. It made me closer to God. There were a lot of life lessons, I would say. Trying to think of what else. What
about medical community? What did you, because you hadn't hung out except, just the casual checking in, you're good, Miss Patterson, see ya. What did you learn about the medical community?
For me, everybody that was involved in my treatment was amazing. So I was blessed. I have great doctors, great nurses, and they're good listeners. Yeah. And that's what I want. Yeah. I want somebody who's willing to listen and give me all the information.
Right. And we have a lot of medical students and nursing students and healthcare professional students who are beginning their journey to take care of people like you and me as we get old and things start to fall apart. And that would be, if you were going to give them some encouragement for their training, what types of things would you say to these young men? Most of them are in their 20s, right? They're in their 20s. They haven't experienced, maybe a lot of sick people. They haven't been sick themselves. What types of encouragement would you give them as they're studying and starting to work with patients?
Yeah, I would just say just to remember that they're humans, right? It's not just a case number.
Yeah.
So I would encourage them to just look at every person as somebody's mother or somebody's father.
Right. Absolutely. Well, thank you so much. I think it's been a wonderful time to sort of learn about your story. We know that breast cancer is everywhere. We obviously have lots of awareness and fundraising and things that goes on all the time. And you're one of those people that has benefited as a result of those efforts. And again, we are so thankful for doctors and nurses and everybody helps to take care of them. But
absolutely,
we appreciate you.
Thank you.
thank you guys so much for being a part of MedCouragement's interview today. And we thank Lori Patterson for sharing her journey with her breast cancer. And as always, we encourage you to reach out to us if you have ideas for things that you'd like us to talk about and people you'd like to interview. We're always excited to do that so we can continue to encourage people in their walks in wellness as well as in illness. Thank you guys so much, and have a great day.